The Health Ministry is mulling to enhance the MySejahtera application feature by allowing Malaysians to sign up as organ donors. Health Minister Khairy said this is because there has been a decrease in the rate of organ donation in the country amid an increasing number of patients requiring transplants, such as kidney transplants. Kidney disease, he said, is fast becoming a major burden globally, including in Malaysia. He said this in his speech at the launch of the 16th National Kidney Foundation of Malaysia Annual Dialysis Conference, themed Holistic Care in Dialysis in Petaling Jaya today. Khairy noted that the incidence and prevalence of treated ESKD have also risen markedly over the last 25 years.
Transplant Registry reported that 7,967 new patients received dialysis in 2015, but by the end of 2016, there were almost 40,000. If the present trend continues unchecked, the number of ESKD patients is estimated to reach more than 100,000 in 2040. The burden that this will cost the healthcare system is an estimated 1.5 billion ringgit and 3.2 billion ringgit respectively. Currently, approximately 8,000 new patients are diagnosed as ESKD annually, and most of these patients must undergo dialysis. Data has shown that in 2020, the cost of treating 50,000 patients undergoing dialysis is about 1.6 billion ringgit. This makes Malaysia one of the highest in the world with ESKD per million population. ESKD in Malaysia also affects the younger age group, and this leads to a loss of livelihood as well as economic contribution to the country. Fortunately, in keeping with key WHO indicators for universal coverage, Malaysian citizens can access subsidized dialysis services by the Ministry of Health, by university hospitals, NGOs, as well as local authorities. However, as you all know, I am a firm believer that we must look at the entire spectrum of care, and that prevention is surely better than just curative care. One of the ways to do this is, of course, to look at preventive and promotive medicine along the spectrum of care, not just in terms of screening, but also in terms of looking at the social determinants behind why people are not getting screened, why people are not getting the care. Are they coming from families which are in a particular socioeconomic group that prevents them from seeking the screening and the care that they require? Do they not have access to this? Do they have transport and logistical problems that make them unable to access the care that they want? One of the ways to combat this is to, of course, increase awareness of kidney disease and prevent its onset and its complication. Our Agenda National Malaysia Sehat program that we launched last year is a movement to educate the masses on NCDs and key lifestyle changes, but also trying to look at the social determinants on how to help them live healthier lives. The key to preventing the onset of other major diseases, not only must we live a healthy lifestyle, eat well, try to exercise, avoid unlicensed products, supplements, avoid stress, don't smoke, but also try to make that easy for people to do. Sometimes it's easy to preach, but it's not easy for people to do this for many, many reasons, especially social and economic reasons. If you have risk factors for getting kidney disease, ensure that you get your regular tests, seek treatment from kidney specialists or nephrologists. If a person is unfortunate enough to suffer from end-stage kidney failure, it is important that they maintain a healthy lifestyle and learn to live well with dialysis. I understand that the best option for ESKD, apart from, of course, dialysis, is kidney transplant. I am aware that the rate of organ donation and transplantation in Malaysia is one of the lowest in the world, and thus people on dialysis may never get a transplant. So I mentioned just now that I'm going to do my best to push pledges this year, make it easier for people to pledge. Let's go big on getting people to pledge their organs so that we have more options for kidney transplant this year. In fact, I'm trying to get the in-app MySejahtera button, so that you can just press a button and pledge to be an organ donor. So every time you check in, you can just press become an organ donor.